Hello, and welcome to our presentation on mental health and well-being for children in Ontario. Our presenters are Anna, Shannon, Frida, Gurpreet, and Manpreet. We will discuss how children's mental health is essential for their overall development, starting with our introduction. We will discuss how children's mental health is essential for their overall development and social well-being. A child's mental health can affect their physical health, how they feel, think, and how they behave. It shapes their ability to interact with peers, cope with stress, and adapt to challenges. Children who have the ability to cope and stress and manage their emotions of self-regulation are more likely to do well academically, form positive friendships, and participate actively in school and in their community. Supporting a child's mental health in their early years is crucial because many concerns first appear during childhood and adolescence. According to the Canadian Mental Health Association Ontario, the CMHA Ontario 2024, it states that early recognition and intervention can lead to better academic achievements, improved relationships, and long-term well-being. Education plays a central role in promoting a children's mental health as well. Programs that teach emotional regulation, stress management, and social skills help create supportive learning environments. Social and emotional learning, peer support groups, and wellness programs not only prevent mental health challenges, but also help children build resilience and problem-solving skills. The Government of Ontario in 2022 emphasizes that these programs are not only preventative, they also empower children to develop resilience and problem-solving skills. Families and communities are equally important in supporting a child's mental health. Children benefit when parents or legal guardians, together with the child's school, provide consistent guidance and emotional support. Children who receive support at home and through community resources develop better coping strategies and access professional support when needed. Through the Children's Mental Health Ontario, the CMHO for 2023. Ontario has implemented policies like Policy Program Memorandum number 169, which requires school boards to create mental health strategies, including promotion, prevention, and early intervention. That's the Government of Ontario in 2022. Organizations like Children's Mental Health Ontario provide evidence-based programs, workshops, and advocacy to help children and their families. We will review 6 key areas in this presentation. They are current challenges in schools, social and financial stressors in families, government policies and programs, and how schools support mental health, and the importance of collaboration. By understanding these areas, Ontario can create inclusive and resilient environments for children to thrive. Current challenges in schools and how they affect students, emotional and social well-being. According to Ontario, principal schools are not sufficiently supported. People for Education 2024. If our goal in Ontario is for all of our students to become active members of their communities and able to bring adult positive change and flourish in society, we must heighten our focus on well-being as a crucial prerequisite for long-term success. We must also acknowledge that the well-being of our children and youth is our priority as a society. The Ontario Ministry of Education, 2016. Current challenges in schools and how they affect students' emotional and social well-being, Part 2. The physical environment of the school impact on student interactions and well-being, and in particular, the effect of being quite constrained in a small space. There's staff composition. When staff consistently is low, this hurts students' well-being. The curriculum, subjects like music, art, and games help students express their emotions and maintain their mental health. Academic performance, pressure of performing well in academics due to parental expectations is a cause of stress and anxiety in children. Quality of relationships in school. Challenges like bias, unequal treatment, and discrimination greatly influence mental health. Jesseman, ETAL 2022. The social and financial challenges in families are affecting students' emotional and social well-being. Financial challenges in families can significantly impact students' emotional and social well-being. The stress associated with financial difficulties can lead to increased anxiety, depression, and feelings of inadequacy, affecting students' ability to focus and concentrate on their studies. The consistent worry about money can also result in feelings of despair and hopelessness, further straining their mental health. Students facing financial stress may withdraw from social interactions, leading to lack of support from family and peers. Families living in poverty must constantly make hard choices between buying groceries, paying for rent, or just purchasing school supplies, make it difficult. The students often suffer by this economic stress when parents are unable to afford extracurricular activities, school supplies, or tutoring that may affect their child's education. Social and financial challenges in family are affecting students' emotional and social well-being. Part 2. Economic stress doesn't just reduce a family's buying power. It basically alters how family members interact and relate to each other. These changes can strengthen some families while straining others. Stressed parents may also become less emotionally available for their children as they are consumed with financial worries. Children may interpret emotional distance as rejection and blame themselves for the family's problems. High school students may struggle the most due to them being the oldest. Maybe they have siblings to take care of while parents work. Having to prepare dinner for your younger siblings, or they may even hold the responsibility of a job to help contribute to the bills. Policy and programs in Ontario. The Ministry of Education in Ontario promotes children's mental health through mandatory mental health literacy for children and youth. They focus on safe and inclusive school environment and provides a development of school-based policies and programs, which is in partnership with organizations such as the School Mental Health Ontario. Since 2011, School Mental Health Ontario has provided to both English and French school districts and authorities with a number of provincial education and health organizations to develop a systematic and a comprehensive approach to schools about mental health. The province of Ontario also supports broader community-based services through other ministries, including crisis support, counseling, and specialized treatment, which can be found in the Ontario government website. Mental health services for children and youth are provided by the province of Ontario. Policies and programs in Ontario, Part 2. The Ontario government implemented a mandatory guideline known as the Policy Program Memorandum, known as PPM 169. The memorandum outlines how school boards must operate and make decisions in accordance with the Ontario's Education Act. The Ministry of Education and Health are committed to working collaboratively to make a continuum of mental health and addictions care across schools. Community-based child and youth mental health providers and hospitals that is coordinated, comprehensive, and responsive to the needs of each and every student. The following requirements for school boards are implemented by PPM 169. We have the 3-year mental health and addiction strategy with a 1-year action plan. Joint local planning with community-based child and youth mental health providers. Multi-tiered system of supports, consistent use of evidence, informed brief intervention, and standardized measurement, suicide prevention, intervention, and postvention protocols. Virtual care delivery, enhanced educator and staff mental health literacy. Enhanced education and staff mental health literacy. Mandatory mental health literacy for learning student. Family mental health literacy awareness. Social emotional learning. Mental health absence. How do schools support children's mental health? They have prevention programs. Schools can play a big role by teaching students healthy coping skills, self-awareness, and stress management. Healthy social environment, a positive school climate by promoting active living, healthy eating, and positive self-esteem. Open communication, creating an environment where students feel comfortable talking about their problems and ask questions. Support services, by providing access to mental health professionals such as social workers and psychologists, as well as teacher and guidance counselors. Safe space, offering spaces for relaxation and quiet area within the school. Anti-bullying policies, actively supporting and enforcing policies and procedures. How do schools support children's mental health? Part 2. Academic success. When the children are feeling mentally well, they can perform better and feel confident and stronger. Resilience. By participating in healthy school programs, help students to develop resilience and cope with challenges. Reduce stigma. Schools provide opportunities to reduce stigma related with mental health issues by encouraging open conversation. The conclusion: children's mental health is essential for their learning, relationships, and overall development. Limited school support, high academic pressure, discrimination, and family money stress strongly affect students' mental health. Ontario strengthens mental health supports through PPM 169, literacy programs, and School Mental Health Ontario. Schools give support and safe spaces, and teamwork with families help children succeed. Below you'll find a list of our references. Thank you for watching.